Hi, I'm Mike Moore, licensed health insurance expert. Today we're going to talk about health insurance. I know it's the most interesting topic for every small business owner, but it's important. So let's get into this. If you're a small business owner, you probably think offering health insurance is either impossible or ridiculously expensive. But there's a solution, and it depends entirely on your specific business. Most business owners believe they have two options: pay a fortune for group health insurance or offer nothing at all. Spoiler alert, there's a third option. It's been hiding in plain sight since 2020. Your best strategy depends on a couple simple questions. First, do you have fewer than 50 employees or 50 or more? At 50 employees, the ACA employer mandate kicks in. Below 50, you're free to offer or free to offer nothing or unaffordable health insurance, which strategically, I'm going to show you how to use that to your advantage if you have a lower income group to get health insurance through government subsidies instead of sponsored by the employer, instead of sponsored by you. At 50 employees or above, the government does mandate that you offer affordable health insurance to your employees. So we will talk about that as well, but there are options for each group in every segment. The answer is ICHRA. ICHRA. It stands for Individual Health Reimbursement Arrangement. I know the IRS really knocked it out of the park with that name. It's super sexy, really rolls off the tongue. Coming this summer, ICHRA. It sounds like a prescription medication, right? But ask your doctor if ICHRA is right for you. Side effects may include saving $200,000. Anyways, let's be serious. Here's what it actually is in plain English. You, the employer, set a monthly allowance for each employee. This could be $0, $400, or $600. You choose. You can choose by class of employee if you have different levels of employees if you have part-time employees, full-time employees, older employees, younger employees, employees in different states. You can choose the classes of employees and offer different amounts with your ICHRA. Your employees then shop for their own individual health insurance plans, and they use the benefits that you give them against the cost of that health insurance. Marketplace plans, off-exchange plans, even Medicare, if they qualify, you reimburse them up to your set allowance amount, tax-free to them, tax deductible for you. So the key difference from group plans is you control your exact budget, okay? And employees get 20 to 50 plan options instead of 2 to 3 that your broker picked. And in many areas, it is less expensive to do this than to get group health insurance plans. Okay, our platform partners, our ICHRA platform partners, we work with almost all of them, will handle all the administration and compliance because it can be difficult, but it's very easy to get done if you use the right platform. Now, you might be wondering why your health insurance broker has never mentioned this. Here's why. Traditional group plans pay brokers 3 to 8% of commission. On a $200,000 group plan, that's $6,000 to $16,000 per year to your broker every year. ICHRA, much smaller commissions, sometimes nothing even. So yeah, they didn't mention it. It could save you six figures or let you offer benefits for the first time at a cost you can actually afford, but their boat payment's more important to them. So these two factors create four distinct scenarios. Okay, under 50 employees with lower income workers, under 50 employees with higher income workers, over 50 employees with lower income workers, and over 50 employees with higher income workers. All right, each scenario has a different optimal solution. If you use the wrong strategy, you're leaving hundreds of thousands of dollars on the table. Don't offer benefits because you think you can afford them. Same problem. So let's look at the first scenario. This is the home run scenario where you really should talk to me immediately. Restaurants with 20 employees, for example, the employees earning 35 to 45,000 per year. Maybe you're currently paying $800 per employee a month for health insurance, or you're offering nothing and you're having trouble recruiting and retaining employees. But if you're offering a group policy to your 20 employees, that's potentially $800 per employee per month for the group health insurance. $16,000 per month or $192,000 annually. That's a lot. Okay, that's a really nice car each year. You could buy a supercar every year with the amount that you're paying for health insurance for your employees every year, just sitting in the insurance company's parking lot. Or more likely, you're not offering health insurance at all because you looked at that $192,000 price tag and laughed. Okay, but here's what nobody tells you. Employees earning under 60,000 qualify for huge federal marketplace subsidies. We're talking $200 to $1,000 per employee per month per person. So the government just gives them the money for insurance. But here's the catch. They can only get those subsidies if you do not offer them employer health coverage that is considered affordable. Okay, now that we can get into the affordability calculation later, but the solution there is to create a ICHRA, an ICHRA, and then contribute zero or very little to it. Okay, and I'm not joking. $0 contributed by you to the ICHRA policy for your employees. If your employees are making less than 60,000 average and you have a small company, allows each employee to have a special enrollment immediately or when they're hired. So your monthly contribution to health insurance at that point could be as little as nothing. You set up the HRA with a $0 contribution. Your only cost is the platform fee if they accept the ICHRA deal, and that's only about $20 per participating employee per month. Your employees shop marketplace plans. They use their federal subsidies instead of you subsidizing their insurance. They pay maybe $50 or $150 or even as little as $0 per month. Your annual cost might be a couple $1,000s, but if you're currently paying for group insurance, you save 185, 190,000 a year doing it that way instead of offering them a group plan. That's a 98% cost reduction. If you're currently offering nothing, you can now offer competitive health benefits for, again, a couple thousand a year. So that means for just a few thousand a year, you can start telling your employees that, hey, we offer health benefits. You can recruit better. You can retain better. Employees like working there more. Everything is going to be better if you can do that, and it can cost you as little as $0 a year if your employees make less than 60,000 a year. Again, if you're confused about this, reach out. I will explain everything. Your employees will decline the coverage because it's considered unaffordable, which is a good thing. You don't have the employer mandate under 50 employees a year. They go straight to the marketplace. They get their full subsidies allowed by federal law and no penalty to you because you're under 50 employees. So employees who want to be strategic about affordability, they can do that and everybody wins. You win, your employees win. It's an excellent, excellent strategy if you're under 50 employees and your employees are at a lower income average. Okay, now the second scenario, like for instance, a tech consulting firm. Maybe you have 25 employees earning 70 to 90,000 annually per year, right? Maybe you're currently paying $800 per employee per month for a group plan. That's $240,000 per year. Or you're not offering benefits because $250,000 for health insurance sounds completely insane, right? And by the way, the government calls $70,000 to $90,000 high income, right? But it still matters. Like their health insurance cost still matters to these people, and if they're paying for their own health insurance, it can get very unaffordable. And guess what? They're going to start looking for another job that pays them these benefits. So these people are making $75,000 a year in a major city, splitting a 2-bedroom apartment with 3 roommates. But according to the federal government, they're basically, not poor. Anyways, back to business. These employees don't qualify for federal subsidies because apparently they make too much money to need help. The strategy here is an ICHRA with employer contributions. You can contribute $400, maybe $600 per employee. Again, you can break it up into classes and offer different amount to different classes. Your employees will shop plans and pick what works for them. Your annual cost, approximately $134,000 if you do something like that, and you would be saving, maybe 44% versus your group policy, which is huge. So you want to offer benefits. The ICHRA policy allows you to get the even cost. You know exactly how much you're paying. You can control your costs, and your employees have a better experience with it and get a more affordable package of coverage for a lower price, right? So again, in this scenario, everybody's happy except for your broker, but he'll be fine. He'll probably still make his boat payments. Third scenario. This one's more complex. Let's say you're a manufacturing company with 65 employees. So you have over 50 employees, the government mandate kicks in, and you have to offer affordable health insurance from the employer to the employees. The average income is lower than 60,000, maybe 42,000 per year. Maybe you're paying currently $800 per employee per month. That's $624,000 annually. Or you're offering nothing and just hoping nobody notices you have more than 50 employees. Here's the problem. Once you hit 50 full-time employees, like we mentioned, the ACA employer mandate kicks in, and you can be fined per employee that you do not offer affordable health insurance for, which can itself be extremely expensive. So this is the government's way of saying, congratulations on growing your business. Here are some fines. It's it's like a participation trophy, except it costs you $283,000. Here's where it gets messy. Your employees would qualify for federal subsidies based on their income, but when you offer them affordable coverage, which you're legally required to do, they lose those subsidies. That is the way you have to do it to stay compliant with the affordability mandate. So if you were smaller, the government would subsidize your employees, but because you're successful, employ more people, now you have to subsidize them. But there still is a better solution. The ICHRA is still better. Contributing maybe $350, $400, $500 per month, you can save up to 50% of your cost versus a small group plan. And again, your employees can go into the marketplace and probably still find lower cost coverage to them using the marketplace plans than the small group plan. So if you're currently paying for group insurance, you might save $300,000, over $300,000, a 50% reduction in your cost as an employer. And if you're currently offering nothing, you can stay compliant for $300,000 instead of paying $283,000 in penalties. So again, everyone ends up better if you're doing the ICHRA, although this is the most difficult segment. The over 50 employees who are earning lower income, it's not the best scenario as far as health insurance goes, but there's still better options and worse options. And the ICHRA option is still better than a small group plan. Now, the fourth scenario, this one's actually good. Professional services firms, 80 employees sort of thing. Average income, maybe $72,000 a year. Currently paying $800 per employee per month. That's $768,000 annually. Or, again, if you're not offering benefits at all, you'll be penalized, just like in the last scenario. Here's why this scenario is better, though. You're subject to the ACA mandate, but your employees don't qualify for marketplace subsidies anyways. They make too much. Remember, 60,000 is the cutoff for individual subsidies in the ACA marketplace, because apparently the government thinks that over 60,000 and you're making plenty enough money to pay for these $1,000 health insurance plans. So there's no subsidies being lost. You're just changing from an expensive group plan to a more cost-effective ICHRA plan. So contributing, let's say, $450 per employee per month, your annual cost is now $477,000, and you're currently paying for group coverage, you'll save, somewhere around $300,000 annually, a 38% or so reduction. If you're currently offering nothing, you can stay compliant for $477,000 instead of paying $768,000 in penalties. Okay, your employees will get 20 to 50 plan options with, potentially better network providers. This is actually the cleanest scenario for companies over 50 employees. You save money, stay compliant, no subsidy complications. It's as close to a win-win as you get when the government is involved. So here's the summary. 20 employees, lower income, save $188,000 annually, or offer benefits for a few $1,000s instead of offering nothing. 25 employees, higher income, save $106,200 annually, or offer benefits for $133,000, $134,000 instead of paying a couple $100,000 in penalties again. If you have over 50 employees, like the 65 employee lower income scenario, you can still save about $300,000 annually compared to your small group plan, or stay compliant for half the cost of your penalties. At 80 employees for a higher income, you can save $291,000 annually. That is a very clean implementation. These are real numbers, but notice how different the strategy is for each one. That's why generic advice doesn't work. Your broker saying just get a group plan can cost you six figures in almost any one of these scenarios. It's at least worth checking out if an ICHRA can save you money. It is a bit regional. The difference in the marketplace and IFP plans that are off exchange, which will be available to your employees who are on an ICHRA, the ratio of those types of plans versus the small group plan does vary per state. So there are some states that have extreme cost savings, like Indiana, Ohio, some different, like there's a lot of different states. Just check with me. I'll point you in the right direction. If your small group plan is actually better for you in some states, it might be, then don't switch. But most employers who we work with save at least 30% from their small group policy, and their employees end up happier, more satisfied with their health insurance, and significantly happier with their employer situation, because now they're getting benefits. It's an important question. When can you do this? And the answer is anytime you want. You're not locked to your renewal date. You can cancel your existing group plan and start an ICHRA immediately. That your employees will have immediately. The group policy will stay in effect for 30 days or something like that. Just depending on when you cancel, could be up to 60 days. But between 30 and 60 days, your group plan will be canceled. Your employees can enroll in marketplace coverage or off exchange coverage immediately after their group policy is dropped, or before the group policy is dropped. The ICHRA supported policies, the marketplace policies, will go into effect as soon as the group policy is dropped. So let's say your group plan renews in March, cancel it. If you can cancel it now, you don't have to wait till March. Start the ICHRA immediately, right? So you don't have to sit there thinking, well, I guess I'll just keep hemorrhaging $200,000 for 10 more months until renewal. You can cancel your group policy now. And I and my team will help you enroll into new health coverage. You help every single one of your employees enroll in new health coverage that saves you money and saves them money. Better for everybody. So anyways, you are not stuck. Your employees should not be stuck in the group policy. You can change everything. You can cancel immediately. So beyond the cost savings, there's, of course, another benefit. If you don't offer health insurance, you're competing for employees with one hand tied behind your back. Okay, with an ICHRA, even a $0 ICHRA, you can put health benefits available on every job posting. Your postings, line cook, $18 an hour, health benefits available. That's way better than $18 an hour without health benefits. Where do you think that line cook is going to work? Right? The competitor down the street, $19 an hour with no benefits. Who do you think that candidate will go work for? Okay, even at $1 less per hour, they're going to come work at the place that offers health benefits, and those health benefits can be offered through a $0 ICHRA at no cost from you. The employee will get a special enrollment to enroll in the marketplace as soon as they start working for you, because you offer that $0 ICHRA. It's very strategic. This is incredibly important. If you're under 50 employees with lower income employees, absolutely reach out to us, and we will help set this up for you. It's something that almost nobody talks about, but is incredibly strategic and a very good idea. Now let's talk about retention. Cost of replacing an employee, usually $10,000 to $20,000 for higher earning employees. Recruiting, training, lost productivity while they figure out what they're doing. If your $0 ICHRA costs a couple thousand annually and prevents one employee from leaving, you're already ahead. Okay, this pays for itself. If you can simply get your employees health insurance benefits, they will stick around because your company is different. Your restaurant or small business offers health insurance benefits, whereas the competitor down the street does not. Right? So research shows offering health benefits reduces turnover by 25 to 40%. So yes, you're saving $200,000 on insurance by not offering a group plan, offering an ICHRA instead, but you're also building a stable team that doesn't quit every 6 months because they found a job with benefits. That is a real value to your company. Okay, here's the key point. The right strategy depends entirely on your specific situation. Employee count matters. Under 50 means no government mandate. Over 50 means the government mandates you provide affordable health coverage. Income levels matter. Under 60,000 means federal subsidies could be available to your employees. Over $60,000 per employee means your employees are wealthy and don't get subsidies from the marketplace. So these factors create four completely different segments. Each segment has its own best option, best way to approach it. Low income, under 50 employees, the $0 ICHRA is absolutely the best. Please reach out to me if you're in that situation. We can help you very, very much. You spend almost nothing. Employees access subsidies. The high income under 50 employees is best serviced by an ICHRA with contributions. You can still save 40 to 50% versus group plans. And if you're offering nothing, then the ICHRA is by far the most affordable and best way for you to retain those employees and recruit those employees. So I'd highly recommend you doing this if you are under 50 employees, whether higher income or lower income. The low income employees over 50 person groups, the ICHRA ICHRA with required contributions is by far the best way. You will be fined by the government if you don't offer affordable health insurance. We will help you set that up. Make sure it's done affordably. Make sure that you have, exactly what you're paying. You won't have your price raised every year like it does in the small group plan. And you can probably save about 40% versus your small group plan. So you save money, still very significant, although this is the most difficult segment to service. The high income groups who are over 50 employees, the ICHRA absolutely makes sense. It's a very clean, great implementation of the strategy. There is no subsidy complications because nobody, your employees are too rich to be able to get subsidies from the government anyways, and you absolutely save money versus a small group plan while giving your employees more options. So in any of these situations, reach out to me, talk to me. Let's discuss how much money we can save, and we can help your business offer better benefits to your employees. The restaurant owner and the tech firm both, let's say they both have 25 employees. The strategy is completely different, but the answer is still the ICHRA. The ICHRA, one size does not fit all, and generic advice will cost you money, but that's what we're here for. We will help you with your specific situation and make sure that we save you money. But saving money is not the only thing, and the recruiting and retention benefits aren't the only benefits. There's also tax benefits. There's on the federal level, ICHRA contributions are 100% tax deductible to the employer. They're also 100% tax free for the employee, same as group premiums. Reimbursements to employees are tax free, but that's not it. Several states actually offer additional tax credits specifically for ICHRAs. Indiana offers $400 per employee in year one and $200 in year two. This is in addition to everything else we just mentioned. In Ohio, there's pending legislation for something very similar. Well, they will pay up to $400 per employee per year to give you back some tax credits for initiating an ICHRA. Texas is doing something similar, sales tax refunds starting in 2026. Georgia is doing something similar, $600 per employee for the smallest businesses. These states are trying to encourage you to put your employees into the marketplace risk pool so that they can try to keep their costs down for those marketplace risk pools, and therefore they are incentivizing you with tax benefits to do that. If you're in one of these states, reach out to me. The ICHRA could be a very good idea for you. Let's go through a specific scenario. In an Indiana business with 20 employees contributing $400 monthly, okay, your federal tax deduction will save you $24,000 a year, and Indiana credits will add up to $8,000 more per year. So your combined tax benefit will be $32,000 in year one. This is in addition to saving money versus your group policy, and in addition to retaining and recruiting your employees, or recruiting and retaining, excuse me. So you're saving money on insurance and getting money back on taxes. It's almost like they want you to do this, which of course they do. So if you're interested, here's what you should do. Take our quick survey. It'll help you identify exactly which segment you're in, although you probably do know which segment you're in. We will send you the Small Business Health Insurance Survival Guide for your segment. This guide breaks down all 4 scenarios in detail. It shows you the optimal ICHRA strategy for your type of business, and explains why the alternatives, expensive group plans, doing nothing, or other forms of ICHRAs don't work as well as the type of strategy that we recommend for your business. So this helps you identify exactly what you need to do. It points out, it'll summarize all the things I'm talking about here for your business specifically, and let you know what your best potential option is. So all you have to do is figure out what segment you're in. We help you do that through the survey. We send you the Small Business Health Insurance Survival Guide specific to your business segment, and it'll explain exactly how you can go move forward in the best possible way. Now, all you have to do, take that survey now. You'll have immediate access to it. Stop overpaying for health insurance, or stop thinking you can't afford to offer benefits, because apparently 60,000 is high income and the government has very interesting ideas about math. So do the right thing for yourself, and we are here to help you. Okay. Again, I am Mike Moore, licensed health insurance expert. Uh, I'm here to help you. I'm here to walk you through it and make it easy for you. Okay. We make health insurance simple for small businesses. Don't worry about it. Don't think about it too much. Take the survey, get your Small Business Health Insurance Survival Guide, then schedule a meeting with me, and I can take you through your exact savings and see if this makes sense for you. Okay. So anyways, let's go over a couple key takeaways. There are 2 factors which equal 4 different segments, and therefore 4 different ideal strategies. That's your employee count and the average income of your employees. The ICHRA on average will save anywhere from 40 to even 100% of your, comparable small business employer costs. You can start at any time. You are not locked into your renewal of the small business employer policy. You can cancel it and start your ICHRA anytime. Recruiting and retention is absolutely improved if you do something like this. There are tax benefits, especially tax benefits in certain states. We partner with the top ICHRA platforms in the country to help you administer this in a very, very simple way. And again, it's your choice. Do you want to pay for your broker's boat payment, or would you rather save 6 figures for your business? So again, take the next step, take the survey, figure out which segment you're in, then go through the Small Business Health Insurance Survival Guide and schedule an appointment with me. I will show you your options and make it very easy for you. Thank you so much. I'm Mike Moore. See you later.